Welcome back to Primetime News and a special welcome to those of you watching on onespotmedia.com. There are now 58 confirmed cases of COVID-19 in Jamaica. The health ministry says 3 more samples tested positive in the last 24 hours. They are a 41-year-old woman from St. Ann with no travel history, and her mode of transmission is being investigated. The second is a 52-year-old man from Portland with a travel history from Brazil. The third positive in the island is a 41-year-old woman from Clarendon with a travel history from New York in the United States. The breakdown shows 30 imported cases, 22 import-related, and 6 under investigation. An 8th patient has also recovered from the virus and has been released from hospital. 5 patients are still awaiting a second test before being released. Meanwhile, there are now 1.2 million confirmed cases of the coronavirus across the globe. Johns Hopkins University, which has been tracking the cases, reported that nearly 70,000 people have died from the virus worldwide. The United States has the highest number of confirmed cases. And we'll return to more COVID-related news in a moment, but first, 4 correctional officers are injured following a prison riot at the Richmond Farm facility in St. Mary. A top-level probe has been launched into the incident, which forced the intervention of the police and military. A knife and a phone were also found in prison cells. The cries from inmates at the Richmond Farm Correctional Center in St. Mary. Others stared helplessly through a window. So intense was the occasion that correctional officers had to call police and soldiers for backup. The reason? Well, this video has been making the rounds on social media. It shows an inmate on the ground seemingly in pain. His colleagues claim he was beaten. They came to his rescue by pouring buckets of water on him. Sunday afternoon, when TVJ News spoke with Matthew Samuda, the minister without portfolio in the Ministry of National Security, he could not say if an inmate was injured. But he did confirm a disturbance at the Richmond Farm Correctional Center minutes after 11 Sunday morning. It all began when correctional officers carried out a routine search.
Some contraband was found and there was an attempt to remove it, including a smartphone, I believe it was. There was an uprising of sorts from the prisoners who were having their contraband removed, and it resulted in an incident where 4 DCS members of staff were actually injured.
Mr. Samuda refused to disclose the nature of the injuries, but he did say they're not considered life-threatening. For the most part, operations at Richmond Farm have returned to normal.
We're conducting searches throughout the rest of the facility. As you can imagine, investigations will be launched into the source of this contraband, and certainly it's an investigation into the total incident.
In the meantime, as part of COVID-19 containment measures, correctional facilities will be getting thermal scanners to test the temperature of workers.
The equipment is due for delivery on Monday, as in tomorrow. So once it's delivered, that will be done at all facilities. It is being done at some facilities at this stage. We've also instituted a questionnaire, which all members of staff have to answer when entering. So there's a pre-screening process. Additionally, beyond the temperature and beyond the questionnaire, we will be using surgical masks, which are not the N95s, but the lower end masks within our facilities starting this week, because what those do, they help you to curtail the spread, and all of our employees could eventually become vectors. So we want to ensure that we protect them from spreading it both to prisoners and to their other staff members.
The aim is to keep prisons COVID-free.
There is no coronavirus within any of our facilities at this stage. We had 2 scares previously. One person was tested and tested negative, but the other person did not meet the standards for testing as per the public health regime. But both persons remain in isolation just to make absolutely sure.